And since the end of April, the Houston Health Department has received reports of 14 new Mpox cases. Mpox is the one formerly known as monkeypox. During the outbreak between May of 2022 and March of 2023, the department received reports of 727 cases. Houston then went without any cases at all for 6 months and only seeing sporadic cases since this past November. Dr. David Persse, Chief Medical Officer for the City of Houston, is joining me now to discuss this. It seems like we might need a little bit of a refresher on what this is, Dr. Persse, because, you know, Mpox, we used to hear about it as monkeypox, but admittedly, in the past few years, we've had a lot of viruses to keep separate.
Yeah, you're absolutely right. So it is time for a refresher. We are seeing Mpox come back around again, and this is somewhat to be expected, but we can do something about it. And as you said, it's a virus caused by, it's an illness rather caused by the virus known as monkeypox, but it's in the same family as cowpox and smallpox, and so it can be serious. And we know that people are going to get sick with it. When they get sick, they get flu-like symptoms. They feel crummy. It will keep you out of work. You then get a rash. It would be painful rash, and so we really want folks to avoid getting it. It's spread predominantly skin-to-skin contact, so you have to be close to the person, and especially if they've got that rash. Those rashes, those sores, the scabs, they're just loaded with virus, and so it's very easy to transfer from one person to the next if you've got that skin-to-skin contact. But in addition, if you use like bedding or towels that somebody who has the rash, it gets into that, so you can be transferred that way. And then again, if you're really close to somebody, whether it be close, conversation or kissing, it can be spread by respiratory droplets and saliva too. So a lot to think about.
Yeah, bedding, and that means that even like parents and children, it would be a risk of them transmitting it to their children.
That's right. Now, fortunately, so far we've seen very few cases in children, but you're absolutely right. So if an adult has it, you need to pay attention to towels, sheets, clothing, because it can transfer that way too. So you're absolutely right. Yes.
So in the height of this, we had 727 cases in Houston. Right now, you've seen about 14 cases. Does that mean that this is something that you're starting to worry about? Does this mean that there's been an uptick recently?
Yeah, it appears so, because these 14 cases are predominantly unrelated. So everybody who we know has it, who's reported it, they got it from somebody else. So there's probably more out there than just the 14 cases. And so again, we want to remind people, what to look for, because a couple things. One, if you get it, if you have it, you can go ahead and if you do act quickly enough, you can start getting vaccinated for it. We'll talk about that in a moment. But then also, you know how to stop spreading it. And you may not, if you don't know you've got it, you don't know what to do. You don't know you need to stop spreading. So this is why we want to get it back on everybody's radar again.
Tell me what the symptoms would be that would indicate to somebody that they need to go to the doctor. I mean, I remember people talking about how painful it was, but what exactly would indicate to them that they need to seek medical care?
Yeah, so it starts off with flu-like symptoms. So, so many viral illnesses start off like flu-like symptoms, and you don't really need to do a whole lot about it, but it's going to be fever, chills, body aches, swollen lymph nodes, headache, backache, those sorts of things. The hallmark for the Mpox is when you develop the rash. And the rash will start off as a very small, looks like a pimple. It will then look like a blister. It will then rupture. It's painful, or when it ruptures, it's painful. Before that, it can be itchy. It'll rupture, it'll be painful. It'll then scab over. That's really the hallmark. And so and here's the other thing, is that the incubation period can be up to as much as 3 weeks. So, it's a real challenge. But once you get that rash, again, they start off as small, look like pimples, generally multiple pimples in one area of your body. They'll then become blisters, they'll rupture, painful, and scab over. And those are highly infectious. Those rashes are highly infectious.
And who's at risk of getting infected?
Well, of course, anyone can get it, and I think that's one thing we want to keep in mind. Right now, we're seeing it predominantly in gay, bisexual men who have sex with other men, but anybody can get it. If you've had close contact with someone who's got the rash, then what you want you to do is go ahead and get vaccinated as quick as possible. And we at the Houston Health Department, we can provide that vaccine for you. But and then in addition, of course, are the usual folks that are at high risk for any infectious disease, those with weakened immune systems, those who've got HIV, patients on cancer therapy, patients who are chronically malnourished. Those folks are, of course, at high risk for having serious complications should they become infected.
And you mentioned the vaccine earlier. So there is a vaccine against Mpox. Yeah. Is that something you should get as soon as you know you've been exposed?
So the Jynneos vaccine is really best for prevention. But if you have started with the rash, you can go ahead and start getting vaccinated if you act quick enough. Now, it's a 2-shot sequence. It's about 4 weeks apart. But if you are someone who thinks at risk and you get yourself vaccinated ahead of time, this is a highly effective vaccine, greater than 90% effectiveness with this vaccine. So if you think you're somebody in the group, the men who have sex with men, or you have multiple sexual partners, even heterosexual, multiple sexual partners, and you want to get vaccinated, you should go ahead and do it. It's a really very effective vaccine.
And if somebody maybe doesn't know where to get the vaccine, or they don't have health insurance, or they don't have a regular PCP, where can they go to get the vaccine?
Yeah, so your local health department, the Houston Health Department, we're the public safety net for the residents of the city of Houston. You can call us at 832-393-4220 or visit houstonhealth.org, and we will go ahead and get you lined up to get the vaccine.
Okay, Dr. Persse, thank you so much for joining us. That's really good information, especially since that one's kind of not really been at the top of mind for a year or so.
Well, we want to keep it that way, right?
Yeah, exactly. That's why it's good that you're joining me this morning. We appreciate your time, Dr. Persse.
Thank you, Haley.